You're so difficult to work with. You're just all over the place. Oh, okay. So video.
Right. What a new day. This is the Loudmouth Birth Advocate, and welcome back. So today the topic is Birth Matters. Not the title of a book, which I will get into that later on. But why does birth matter? It matters for everyone. Whether you plan to have children or not, the health of the person that gave birth to you and that person's health during pregnancy and what happened during your birth has an impact on the rest of your life. So let's get into that. First off, I hope everybody survived the holidays, and I definitely hope that you're surviving the pandemic. Wherever you're viewing this episode, I really hope that all is well with you and your family, whether they're chosen or original. There's way too much drastic illness and death going on, and I'm very, very grateful for the health of my family. We've been lucky so far. So, a big thank you to Epicurean Bard, who can be found on the platform called Discord, and some other places, but I know Discord for sure. And she has designed our awesome new logo. Very excited about this new logo, embracing everything I feel about what I intend with this channel. Next, you'll find in the information in the channel a playlist called Recommended Videos. In there, I've started to accumulate a bunch of videos that cover subjects that I'm not going to cover because other people cover it really well. I'd rather focus on the intention of my channel, which is spreading information about maternal health and my fondness for the movies, which we'll get into in future videos. So if you are curious about, for instance, there's a video in there by a home birth midwife covering common home birth complications that are safely managed at home and how they're managed. There's a video in there of two pediatric related professionals covering several myths about the life period of pediatrics. Very good information in there. So today's subject: why does birth matter? Who's affected by this subject? Well, everybody. I currently haven't heard of any humans being hatched. And even at that, eggs are born from animals that hatch eggs. So birth matters. It affects everybody. Everyone is born. And an interesting bit of research. David Barker developed what we now call fetal origins. It basically says that the health of the person giving birth before they get pregnant, while they're pregnant, affects the health of the child that's born. Some similar research is called epigenetics, which means you've got, we're going to rewind to biology class here. There's the genotype and then there's the phenotype. The genotype is, okay, I can't make a gene out of my hand, but say this is a gene, and expressed on this gene is you can have either blue eyes or green eyes. And because one of these is a recessive gene, that means the other one is the default. The dominant gene is what gets expressed in the phenotype. This is what's physically visible, is one way to remember it, the pH. So you get blue eyes. Epigenetics also involves what diseases you're predisposed to, or maybe how your body will react to those diseases. An example of the prenatal impact of this on babies. A TED Talk by Dr. Annie Murphy Paul. She wrote a book called Origins. I don't remember what the byline is, but the talk is linked down below. She talked about an experiment where during the prenatal period, mom was in her in the diet she was already eating to also eat certain specific foods. And then they looked at the babies when they started eating solid foods. Was there a correlation? And there was. For instance, if mom ate foods that had kind of a sweet taste, then the baby would be very willing to eat foods that had a sweet taste. And interestingly enough, also had an aversion to food that did not have a sweet taste. It was harder to encourage them to eat those foods. So obviously, those foods are going to have an impact on that child's future health. Another thing that affects why childbirth matters to us is the perception. Certified professional midwife Ina May Gaskin, one of her recent published books, I'll show you a picture of it here. Her book is titled Birth Matters, published in 2011. In this book, she talks about a lot of really important history that has not been revealed. For instance, Dr. Hugh Hodge in Pennsylvania taught his medical students to teach patients to fear birth. Why? Because if childbirth seems scary, then maybe it would be better for a doctor to help them. I mentioned this in my history of childbirth video before that I'll link down here below if you haven't gotten a chance to see it. So how the public perceives childbirth changes how we interact with childbirth and the choices that we make. If childbirth was not fearful, then maybe we would, instead of pursuing surgeons, because obstetrics is a specialty of surgery, it's not a general medicine specialty, then maybe we would pursue the experts of normal birth, which are midwives. Midwives have had tons of experience over childbirth for centuries. And because of that, as Ina May Gaskin found, the outcomes of childbirth, especially in the U.S., would be dramatically better. She found that countries where midwifery managed most of or a large portion of childbirth in that country, the mortality rates were much lower, as well as other outcomes of childbirth. Here's the broader perspective. The healthcare system itself. Insurance companies today dictate what healthcare choices are made. They dictate to doctors how to practice medicine. And it's especially true in obstetrics. In the 1980s, there was this big conflict there were mothers who realized that they could ask for C-section. For one, it would end their pregnancy faster. And there was unfortunately a lot of women that saw this as an escape from the labor experience itself because they feared childbirth. So why not just bypass to major abdominal surgery, which is C-section? Nobody really thought of it as major abdominal surgery until after they had to recover from major abdominal surgery. At the same time, our society got very litigious because of the obstetric management of childbirth. There were a lot of infant deaths, maternal deaths, newborn injuries that happened, so parents were suing obstetricians for the health care that they got. In reaction to that, insurance companies started dictating, we're losing a lot of money here, so doctors, you need to do this and that. And so the doctors are in the middle of all of this stuff, unfortunately. And home birth was not very popular, so there was no other option. You went to an obstetrician who had to manage your care based on what an insurance company told him he had to do. Him or her. I'm sorry. My sexism. Very sorry. I'll correct myself. At the same time, medical malpractice liability insurance. And that insurance is what paid for the lawsuits. So those insurance companies were also dictating to obstetricians about what kind of health care they could provide and how. So, a broader perspective of this. There is a public health concept. Some people use a couple of different terms in relation to this. There's the social determinants of health, or upstream, downstream health equity. I'm going to show you a picture here. Basically, for instance, if I have diabetes, then part of my personal responsibility, or the downstream effects of healthcare, is that I need to regularly monitor my blood sugar. I need to take insulin if my doctor says that my diabetes have gotten bad enough and out of control enough that I need to manage that with insulin. And at the same time, I need to eat well, better than most people. Quite frankly, all people need to eat like diabetics should eat, but that's a different story and a different video. The upstream effects of this: what if I'm not a white woman living in quite a bit of privilege? For instance, my nearest access to fresh fruits and vegetables. No, let's rewind that. In less than a mile from my house is Quick Trip, where I could get all sorts of processed food. And yes, for those that don't live in the area, Quick Trip is like a big name convenience gas station place. There are fruits and vegetables there, not a whole lot, and definitely not much of a selection. And Quick Trip has gotten a lot better about the selection of their food and the health of their food. I digress. The whole point is people go to eat food at Quick Trip because it's processed, it's packaged, it's convenient, you can grab and go. Not because it's healthy, typically. Now, a little further, but still less than a mile from my house, is a big name chain grocery store where I have an entire produce department full of fresh fruits and vegetables. What if I wasn't a privileged white woman? On the other side of town, there's a long-standing history of having no such store for miles. Miles. So if I didn't have transportation to be able to get to the store, I've got to use a bus, which is the case for a lot of people who, this is not an exaggeration, some people spend 5 hours on 2 or 3 buses, maybe one way, just to get to the store to get fresh fruits and vegetables. So, if it's that difficult to get access, how helpful is the suggestion to eat well? That is far from everything about the subject. I'm definitely not going to have all the answers. Feel free to research on your own. Please do. Yay, education. So now it's in your hands. In the next videos, some of the subjects that I'm going to be covering for you to look forward to are words are powerful. The next video, I'm going to be covering the way words have been used in relation to childbirth, either directly to a patient or client, or just about the subject in general, in the society's mind of what childbirth is. And further down, I'm starting to do some work on the history of obstetric practices. So I'm going to narrow in on the kinds of practices that obstetrics has used since its inception just 200 years ago. 18, 19, 20... 250, less than 300 years ago is the inception of the obstetric specialty. Now, if you have any comments, or especially if you have any questions about the information that I shared, or maybe some related topics, or even some suggestions about future video subjects, or just in general for the channel, I welcome that. Critique of the subject is very welcome. And if you like this video, give it a thumbs up. If you don't, give it a thumbs down. It's a way of voting. One tidbit I need to add in here. This grad school student is going back to school next week. So the timing of these videos will probably be spaced out a little bit. I'll be giving updates on my Facebook page and on my Instagram account. Feel free to check those out if you like to have some interim information between videos or just general updates. I will also try to put updates in here. The benefit of subscribing to my channel is it's a lot easier to find new videos or even old videos that you've missed or videos you'd like to see again. If you click the bell next to the subscribe button, you'll get notifications. That way you don't have to go hunting again and again. Makes it nice and convenient. It gives you an alert if you have notifications set up on your device. It'll let you know the next time a video is posted. As always, I'll post resources that I've used to produce this video at the end of the video if you'd like to check those out. And I especially want to ask, please be kind to all your fellow human beings, no matter their diversity. See you later.